There have been concerns about the lack of urgency on a vaccine campaign to get the country vaccinated. Solidarity Fund has been working closely with the National Department of Health to ascertain way it can contribute to the program. South Africa's low COVID-19 vaccine uptake and the devastating July unrest in KwaZulu-Natal and parts of Gauteng have warranted the Solidarity Fund continuing its work and extending its lifespan until at least the end of September 2022. Now, Solidarity Fund, in partnership with the Department of Health, will be launching a national campaign to urge citizens to get vaccinated. For more on the story, we're now joined via Zoom by an old colleague of mine, Wendy Tlou, who is the Executive Head for Humanitarian Response and Behavior Change Pillars at Solidarity Fund. A very good morning to you, Wendy.
Morning, Des. How are you?
I'm good, thanks. Tell us about this campaign that Solidarity Fund, together with the Department of Health, will be launching.
Well, the campaign, first of all, is data-led. It's really a culmination of the work we have done in terms of studying some of the research studies that have been done by a number of institutions. And that have pointed out to that about 2/3 of the adult population intends to get vaccinated. However, we have been seeing the inertia. But they also direct us in terms of what some of the concerns, the perceptions, the attitudes, and the behaviors of South Africans are in terms of the vaccination. And really the campaign is about injecting a sense of urgency in terms of us getting vaccinated, so that we can have about 28 million adults having been vaccinated, at least with the first shot, by the end of December. So I think that it's really about calling on South Africans and us heeding the call to get vaccinated, ultimately to the benefit of all of us, so that we can get back to living. And that living really manifests itself in us exercising ourselves as social beings, but also importantly about rebuilding the economy.
But of course, Wendy, the other side of this call is the question, do we have sufficient supply of vaccines in the country to ensure that people who wish to get vaccinated do so?
Yes, Des, we definitely have enough supply. Yes, when you look at the start of our vaccination program, there was a lot of stops and starts in terms of the vaccines that had been procured, the efficacy against some of the variants that were discovering as the pandemic progressed. But we can certainly say that now we have got the vaccines. The government vaccine rollout is really out there for us now as citizens to go and get vaccinated and get jabbed. So there is no doubt that the supply is definitely there, and we now have to just make sure that we get those jabs in our arms.
Yeah. Just in terms of the timing of the campaign, why was it not launched when the vaccine rollout started? Why now, and what difference will it make?
Look, we actually have had a number of campaigns in the market. This is the third campaign that we are running in 2021, essentially. But we need to remember that the pandemic progress has been a journey. It's been a journey about firstly understanding what this pandemic is about, and therefore educating people about the measures and the non-pharmaceutical measures that they can take in terms of fighting and stopping the spread of the virus. Secondly, towards the middle of the year and leading up to Easter, we did another campaign which we called When We Come Together, which was two-pronged. One was about encouraging people to maintain these non-pharmaceutical interventions of social distancing, ventilation, masking up, and sanitizing our hands, but also started to then seed information and education about the vaccines. So we didn't want to go into a situation where we're just telling people to vaccinate without doing the investment in terms of educating people about this vaccine, so that we can allay fears, we can address concerns, and we can get people confident in that vaccines work. At this stage, we also have enough information from the research that has been done to tell us what the attitudes are. Now that the vaccine is here, what the attitudes and perceptions are amongst the South African citizenry, and how to best then locate and package all these campaigns that we're doing so that they start to answer some of the questions that people may have.
Tell us more about that research. Various reasons have been given, but what are you finding are the reasons for the slow uptake?
There are some, most of the reasons, Desiree, are really about the safety of the vaccine, also about the time it has taken to develop this vaccine, and thirdly, around the efficacy of the vaccine. So really the reasons are sitting within that realm or that scope of concerns and worries. And I think the important thing that all of us as South Africans, myself as an early adopter, I got my vaccine as soon as the 35 to 49 classes were opened. But it's to understand that people have real concerns. People have real fears. There is misinformation and disinformation that is spreading like wildfire, especially on social media platforms. So the role that we have to play as communicators within the vaccine program and coming from different sectors of the economy is to also, I think, walk along with people and provide them the credible information that is science-led, that will help them to make decisions for themselves and empower people to say, I now fully understand all the reasons why this vaccine is important. I buy into them, and therefore I will go and vaccinate. Secondly, I think we need to understand that we're not all early adopters. Some people, whether they're buying new product or new services, do take their time in terms of making decisions. What we're saying, though, is that there is an urgency for us to vaccinate as many adults as possible, because ultimately what that does, it reduces the frequency of lockdowns, it reduces the severity of lockdowns, but importantly, that these vaccines work. They work in preventing severe illness, and they work in preventing death. And that really is the only way we can take a leap into, living a life that is about rebuilding the economy, that is about opening up sectors of the economy, that is about hopefully impacting in a positive way the unemployment rates that we see, especially among the youth. So there are many benefits to us actually getting vaccinated. And really this call is about us heeding that call, us going out there in numbers and making sure that the South Africa that we all want to live in is a possibility in the near future, or at least next year.
Of course, today I'm talking to you about your collaboration with the Department of Health, but the Solidarity Fund has moved on and just extended your mandate a bit with giving South Africans help during those protests in July in Gauteng and in KZN. Just give us a sense from your genesis how the Solidarity Fund has changed to adapt, to respond to different requirements within South Africa, not just working with government, but working with NGOs as well.
So the mandate of the Solidarity Fund has always been to be a rapid response organization, particularly focused on responding to the COVID-19 pandemic in three particular areas: in the health area, in the humanitarian area, and in behavior change, which is where the communication and the campaign we're talking about falls under. However, we couldn't stand back when we saw what the impact of the unrests in large parts of KZN and in some parts of Gauteng was. And our board agreed to then extend our mandate to be able to allow us as the Solidarity Fund to respond to that. And really, we've always worked with business, we've always worked with civil society, we've always worked with government in terms of the support that we are providing, because our mandate is strictly located in saying that we need to be supportive of the national effort in fighting this pandemic, but also now, more recently, in the national effort in fighting and responding to the impact of the unrest in KZN. There's a number of projects that we have on the go that are either near completion or just being approved by the Solidarity Fund governance structures, or at least in planning in terms of us responding to the unrest. So really, I'd say that our mandate still remains largely and significantly in terms of responding to the COVID-19 pandemic. We just have this very small extension that has allowed us to then also assist in the response to the impact of the unrest in KZN and Gauteng.
So just finally, before I let you go, research has just come out to say South Africans view the work of government and President Cyril Ramaphosa favorably in terms of their responses to COVID-19. To what extent do you attribute this to the work of the Solidarity Fund?
We are, I think, a significant and influential partner to government, to business, to civil society in terms of the national response. And I think using the results that we issued out last week, where our annual financial statements and annual report showed that we had conducted ourselves well. There was no malfeasance, there was no corruption in the work that we did, from distributing PPE to the public sector, distributing food parcels into the most rural communities in South Africa, as well as running campaigns such as this one to get South Africans to be part of the response to the COVID-19 pandemic. So it does have an impact. It does have an influence. I wouldn't say that it is solely the role of organizations such as the Solidarity Fund. I think that the work that the presidency and the president does needs to be commended if that is how South Africans feel. But I'd like to believe that we are a contributing factor in a positive way around those results that you talk about.
Thanks for speaking to us this morning.
Thank you.
Wendy Tlou is the Executive Head for Humanitarian Response and Behavior Change Pillars at the Solidarity Fund.